Hello, Jamaica. The Ministry of Health and Wellness, and in fact the whole of government, is making every effort to safeguard public health as the novel coronavirus COVID-19 remains a clear and present danger to the island. We now have a COVID-19 comprehensive response plan, which has received the approval of the Honourable Prime Minister Andrew Holness-led National Disaster Risk Management Council. This plan, which is to cost us just under $2 billion, is to do the following: guide the direction, coordination, and management of the health response, support emergency response agencies in the implementation of the national plan, monitor and evaluate key actions in public health to ensure their effectiveness and efficiency in achieving the stated strategic goals of the government to delay, detect, contain, manage, and communicate for COVID-19, as well as to mobilize the needed resources to ensure the comprehensive implementation of key actions needed to realize the goals of the plan. Here is what we project for the coming months if COVID-19 visits our shores and if we have community transmission, based on our experiences with H1N1 in 2009. About 2.6 million acute respiratory cases, up from 1 million or so usually experienced on the island each year. These are persons who will become ill, although most will have mild symptoms. Of the 2.6 million, some 800,000 will seek medical care in public and private facilities. At the height of the outbreak, we could see as much as 35,000 or so people seeking care within a given week. Close to 50% of the more than 800,000 persons we expect to access care in our public health facilities. At the height of the outbreak, we could see approximately 16,000 persons in a week. Further, just about 2,000 of the cases visiting public health facilities we anticipate will experience severe acute respiratory infection requiring hospital care. And of this number, some 360 will require critical care. We have planned for these eventualities with our main activities, including the following: coordinating, including collaboration across government and with other key stakeholders; surveillance, including imposition of travel restrictions now on 5 countries; case management, including treatment; readiness of health facilities; monitoring of supplies; laboratory response, including training to enable local capacity for testing for the virus; sensitization of healthcare workers; public education and communication. I wish to emphasize that the success of our efforts is contingent on the support of all Jamaicans, including the deliberate efforts to access and share accurate information on the virus, thus helping to minimize the fears and anxiety that has been associated with the spread of the COVID-19. At the same time, we must, in keeping with good hygiene, maintain a distance of at least 2 meters from persons who are coughing or sneezing, frequently perform hand hygiene by washing hands thoroughly with soap and water or using a hand sanitizer if hands are not visibly soiled, cover our mouths and noses when coughing or sneezing with a tissue and then discarding it, and avoid touching our faces and each other unnecessarily. The challenge, Jamaicans, is significant. However, if we work together to minimize the spread of the virus and to effectively manage cases, if or when we have them, we can, as we have in the past, overcome this public health challenge. Thank you, and may God bless you.